Welcome to Lewisham and Greenwich NHS Trust Maternity Services. We have two hospital sites, Queen Elizabeth Hospital in Woolwich and University Hospital Lewisham on Lewisham High Street. During your pregnancy, you will have some appointments in the hospital, but it is likely that the majority of your appointments will be with a midwife in one of our community hubs, local to where you live. You can self-refer to our maternity services by completing the form on the Trust website or via the Mum and Baby app. Once you have self-referred, you should receive a booking and a scan appointment. There is a birth centre at each hospital as well as a delivery suite, also known as the labour ward. We also offer a home birth service. You can view virtual tours of our facilities on the Mum and Baby app and also on our Trust website. You can discuss your preferred place of birth with your midwife. Before your booking appointment, there are things that you can do to support your health and the health of your baby. A healthy diet is important to maintain a healthy lifestyle, but it is especially important during pregnancy. Eating healthily in pregnancy will help your baby to develop and grow. You do not need to have a special diet, but try to eat a variety of foods every day to get the right balance of nutrients that you and your baby need. In addition to a healthy diet, we recommend that you take folic acid and vitamin D supplement once a day. You can speak to your local pharmacist for further information. While it is important to have a varied diet, there are some foods that you should be careful with or avoid in pregnancy. Avoid any foods made from unpasteurised milk, such as soft, ripened goat's cheese. Most cheeses are safe to eat in pregnancy, but you should avoid mould-ripened soft cheeses with a white coating or rind on the outside, unless completely cooked. Soft blue cheeses are also best to avoid as they may contain a bacteria called Listeria, which can be harmful in pregnancy. Meat is a good source of protein, and most meat is safe to eat in pregnancy. It is important to always ensure meats are completely cooked before eating them, as if not, there is a small risk of toxoplasmosis and infection that can be harmful in pregnancy. It is safe to eat cold, pre-packed meats such as ham, but you should be careful with raw cured meats such as salami, which may contain toxoplasmosis. If you want to eat cured meat, you can freeze it for 4 days at home before defrosting it, as this will kill any parasites. Liver and liver products such as liver sausage should be avoided. This is due to high vitamin A levels in these products, which can be harmful to your unborn baby. All types of pâté should be avoided as they may contain Listeria. Eggs with the British Lion stamp are suitable to be eaten raw, partially and fully cooked. Eggs without this stamp should only be eaten well cooked. Be aware that some foods, for example mayonnaise and mousse, are often made with raw eggs. Eggs can contain salmonella, which is unlikely to harm your baby but could give you food poisoning. Eggs with the British Lion stamp are less likely to contain salmonella. Fish contains many vitamins and healthy fats that are beneficial to you and your baby during pregnancy. Some oily fish, such as salmon and trout, should be limited to no more than 2 portions a week. This is because they contain pollutants. If you eat too many of these pollutants, they can be harmful to your unborn baby. You should also limit your intake of tuna due to its mercury content, having no more than 2 steaks or 4 medium-sized cans a week. You should avoid fish such as swordfish, shark and marlin, and ensure that any seafood you eat is extremely well cooked. You can find more information about diet and exercise on the NHS website or on the Mum and Baby app. It is also important to keep active and fit in pregnancy. Exercise is not dangerous for your baby, and there is some evidence that active people are less likely to experience problems in later pregnancy and labour. You can keep up your normal exercise routine, such as sport, walking or swimming, for as long as you feel comfortable. Protecting your baby from tobacco smoke is one of the best things that you can do. If you smoke, speak to your midwife who can refer you to our Stop Smoking services. This service will offer you help and support to stop smoking. Stopping smoking will help both you and your baby immediately. If you live with someone who smokes, speak to them about stopping. Our Stop Smoking services are available to everyone. It is important that people you live with do not smoke in the home or smoke near you or your baby. If you drink alcohol, it is important to stop when pregnant. Experts are unsure exactly how much, if any, is safe, so it is safest to not drink any alcohol while you are pregnant. If you are struggling with alcohol, please discuss this with your midwife or GP. At your booking appointment, the midwife will take a full medical and pregnancy history from you. The midwife will record your blood pressure as well as your height and your weight. You will receive your pregnancy notes, and a plan of care for your pregnancy journey will be made with you. At this appointment, you will be offered some screening blood tests. The midwife will recommend a blood test to check your blood group. If your group is rhesus negative, you may be offered some further tests, or you will be offered an injection of anti-D. Around 15% of women are rhesus negative. Your midwife will explain this to you fully if needed. We offer to check your iron level, as some people may become anemic in pregnancy and may require additional iron supplements. We offer to check your blood sugar, and it may be recommended that you have an additional glucose tolerance test or GTT to look for signs of diabetes in pregnancy. The blood test will also look to see whether you carry the gene for sickle cell or thalassemia. These are genetic blood conditions that affect the way oxygen is carried around our body. Some people can be healthy carriers of these blood conditions. If you are found to be a carrier, you will be contacted by a midwife who will explain the result further and offer testing to the father of your baby. We will offer to test for hepatitis B, HIV and syphilis. If any of these conditions are found, you'll be referred to a specialist midwife and team who can offer treatment and support. You will be asked to provide a midstream urine sample. When providing this sample, it is important not to collect the first or last part of your urine, as this increases the risk of contaminating the sample. This will check for any signs of urine infection. Urine infections can be more common in pregnancy, so it is important to keep well hydrated during pregnancy and drink water frequently. Your first scan will normally take place between week 11 and 14 of your pregnancy. This scan will measure your baby and provide an estimated due date or EDD. This date may differ slightly to the one generated by using the first day of your last menstrual period. At this point, you will be offered screening to see how likely it is that your baby has an abnormality in their chromosomes. This test looks at the likelihood of a baby having Down syndrome, Edwards syndrome, or Patau syndrome. If you choose to have this screening test, then the sonographer, the person completing the scan, will measure the fluid at the back of your baby's neck. This is a skin fold of fluid called the nuchal translucency fold, which is normally thicker when a baby has a chromosome anomaly. Following your scan, you will be asked to have a blood test. This blood test looks at the level of protein in your blood, called PAP-A, and the levels of a hormone called free beta HCG. The scan measurements, the blood test, and your age are all used to generate your result. The screening test will not tell you whether your baby does or does not have Downs, Edwards, or Patau syndromes, but it will tell you if you have a higher or lower chance of having a baby with one of these conditions. If your screening test returns a lower chance result, you will receive a letter informing you of this. If it shows a higher chance, the fetal medicine team will inform you and will offer you an appointment to discuss your test results and the options you have. This screening test cannot harm you or your baby, but it is important to think about whether or not you want this test. If you choose not to have this test, you can have a blood test to look at your PAP-A levels. Low PAP-A levels in your blood during pregnancy have been associated with an increased chance of preeclampsia, high blood pressure, and placental function problems. By choosing to have the PAP-A only testing, the midwives can identify if you would benefit from low-dose aspirin to reduce your risk of these complications and offer additional scans to monitor your pregnancy more closely. Your next routine scan will normally be between week 18 and 20 of your pregnancy. This scan is commonly known as the 20-week scan or Anomaly scan. This scan looks for 11 different conditions. The scan will look in detail at the baby's bones, heart, brain, spinal cord, face, kidneys, and abdomen. In most cases, the ultrasound scan will show that the baby appears to be developing normally. Most babies are born healthy and with no physical problems. However, there is a small chance that the baby may still have a problem that is hard or impossible to see using ultrasound. There is more detailed information about the main conditions that are looked for during the scan on nhs.uk.